COVID-19 and travel. What is the CDC doing to help cruise ships with crew still on board? The CDC is committed to helping cruise lines provide for the safety and well-being of their crew members while on board as they disembark. The process for crew disembarkation required during the no-sail order period remains the same during the initial phases of the framework for conditional sailing order. Crew members on ships in U.S. waters who have questions or concerns about COVID-19 on their ship, cruise ship color status. Helping crew lines provide for the safety and well-being of their crew members while on board cruise ships. Cruise ship operators support the efforts to vaccinate their crew. There is a COVID-19 color coding system for cruise ships to mitigate transmission of COVID-19 on board. On-board preventive measures are recommended or required based on ship color status. A cruise ship's color status is determined based on the criteria below. All cruise ships operating in U.S. waters or seeking to operate in U.S. waters must comply with all of the requirements under the CDC Framework for Conditional Sailing Order and technical instructions, even when outside U.S. waters. The CSO was written as a phased approach to take into account the evolving state of the COVID-19 pandemic in the United States and worldwide. Eligibility for ship color status. Ships are eligible for color status based on the following. Established a COVID-19 complete and accurate COVID-19 response plan. This does not mean ships are allowed to resume passenger operations, but rather that they have met the requirements to provide adequate health and safety protection for crew members. Cruise company officials must sign an acknowledgement of the completeness and accuracy of their response plan. Submission of the daily enhanced data collection form. Ships currently outside of U.S. waters are not operating under the CSO and should submit the enhanced data collection form for the 28 days preceding the cruise ship's expected arrival in U.S. waters. Criteria for ship color status. Ship color status is contingent on daily submission of the EDC form and is determined based on weather. There are confirmed cases of COVID-19 or COVID-19-like illness for 14 days and is determined by a qualified medical professional. The ship has received ship-to-ship transfers from a ship that meets the red criteria within the 14 days before the transfer occurred. Land-based crew were not immediately quarantined upon embarking the ship. Confirmed COVID-19 means laboratory confirmation for SARS-CoV-2 and the virus that causes COVID-19 by viral test. COVID-19-like illness includes acute respiratory illness, influenza-like illness, or diagnosis of pneumonia and additional COVID-19-like illness clinical criteria. The status of COVID-19 response plans and cruise ship color status. As a condition of receiving permission to operate in U.S. waters, cruise ship operators must have a complete and accurate response plan that provides adequate health and safety protections for crew members to work and disembark during the initial phases of the CSO. All response plans that have been submitted and is working with cruise ship operators to ensure they are implementing the safeguards outlined in their plans. The determination for color coding status, the ability to operate in U.S. waters, green, yellow, orange, or red, can only be made for ships if the following are true. The CDC has finished the review of the cruise line's plan. Cruise line has returned to an acknowledgement attesting that their no-sail order response plan is complete and accurate, and the ship has submitted at least 4 weeks of surveillance data to the CDC in accordance with the technical instructions. Frequently asked questions. Does the CDC allow commercial travel of crew members? Yes, now that cruise ships have established routine testing protocols based on color status for crew and are working towards vaccinating crew members, CDC is allowing commercial travel of crew regardless of the ship's color code status. Do cruise ships have any restrictions for who can travel commercially? Yes, cruise ships have restrictions for who can travel commercially. The following stipulations apply for commercial travel. Crew members who test positive for COVID-19 cannot travel commercially until they have fully recovered from COVID-19 based on CDC criteria for discontinuing isolation. The use of commercial transport by crew members who have recovered from CDC and met criteria for release from isolation according to CDC guidance. Crew members with signs and symptoms of COVID-19 cannot travel commercially until COVID-19 has been ruled out. Crew members who are identified as close contacts, if fully vaccinated or recovered from COVID-19 in the past 90 days, commercial travel is permitted and there is no requirement for quarantine or testing. If not fully vaccinated and did not recover from COVID-19 in the past 90 days, commercial travel is not permitted until quarantine and testing requirements are completed. Why are ships required to routinely test all crew members during the phases of the CSO, including those on green ships? The purpose of testing during the phases of the CSO is to ensure cruise ship operators have adequate health and safety protection for crew members while they build the onboard laboratory capacity needed to test crew and future passengers. There also continue to be potential exposures on board, including on green ships, such as from newly embarking crew members, crew transfers, and contractors. What does it mean if a cruise line or cruise ship is not listed? If a cruise line or cruise ship is not listed, it means one of the following. The CDC has not been notified that the ship is intending to operate in U.S. waters during the period of the CSO, or it has not completed the review of the cruise line's plan, or cruise line has not returned an acknowledgement attesting that their no-sail order response plan is complete and accurate, or ship has not submitted at least 4 weeks of surveillance data in accordance with technical instruction. As a condition of receiving permission to operate in U.S. waters, cruise ship operators must have a complete and accurate response plan that provides adequate health and safety protections for crew members to work and disembark during the initial phases of the CSO. The CDC has provided feedback regarding all the response plans that have been submitted and is working with cruise ship operators to ensure they are implementing the safeguards outlined in their plans. The following table lists cruise ships operating or planning to operate in U.S. waters during the initial phases of the CSO and have met surveillance reporting requirements. Determination for color coding status and ability to operate in U.S. waters. Green, yellow, orange, or red can only be made for ships if the following are true. There is a finished review of the cruise line's plan. Cruise line has returned an acknowledgement attesting that their no-sail order response plan is complete and accurate, and the ship has submitted at least 4 weeks of surveillance data in accordance with the technical instructions.